Our task is to help replace their despair with opportunity. And this administration today, here and now, declares unconditional war on poverty in America.
Garrett County Community Action Committee was established in 1965, operating out of the back of a station wagon. Since then, the organization has grown to become a 501c3 nonprofit dedicated to fulfilling its mission statement of improving the quality of life for people in need by empowering them to become more self-sufficient and by providing essential services in collaboration and cooperation with partners. Currently, Community Action employs nearly 190 people, generating an annual payroll of over $1 million. The organization serves all of Garrett County with a wide variety of services and programs in response to community need. It owns and maintains over 700 units of affordable housing, operates public transportation via Garrett Transit Service, as well as operating all of the Head Start and Early Head Start centers throughout the county. In a given year, Gccac contributes over $600,000 to the county budget through taxes and fees. We serve approximately 1/3 of the families in our county each year. Over the past several years, we have pioneered a new framework for delivering the supportive services that families in our county need and utilize. The entire agency was reorganized around helping families achieve goals and measurable outcomes, rather than program tallying headcounts. It's commonly referred to as a two-generation approach. The two-generation approach is not a program. It's an approach, a guiding philosophy, a practice. 2 generations, 1 future.
Well, the two-generation approach, at least as practiced here with Garrett County Community Action, I think is a very concrete example of putting into practice what we really believe is the essential and core element to working on poverty issues in Garrett County. We start by really saying that all our systems, all our services need to be designed and operated in a way that support the individual and the family to the end of having them achieve greater economic security and independence. So it's about the systems and services supporting the families, not about families and individuals being fit into a system or into a program.
As much as I love Head Start and early childhood education, which it's a valuable thing, we can work with the kids all we want to. Teach them to read, teach them to count, teach them, how to get along with other people. But if they go home to a family that still lives in chaos, many of the things that we've taught them are going to go away. Little by little, those things are going to diminish. So if we can work with the kids and also work with the families to help them get to a place where they can pay their bills, we can teach them financial literacy, we can help them get better jobs, we can help them budget their money so that they can make it, that takes a great deal of pressure away. And so the whole family heals. And so that the 2G approach to me just seems like something we should have been doing all along, was working with the whole family, because no family is just one person.
It was surprising to us as we went through the process that that we had built up our own silos, that we'd built up our own walls in terms of programs, and we actually had difficulty understanding and knowing what we were doing within our organization. So we had to spend a lot of time changing that, and that was an organizational culture shift.
Before we really embarked on our 2G approach here at Community Action, we were like many other agencies across the country. We were very siloed in our program delivery, we were very siloed in our data management, and one end of the hallway didn't really understand or know what the other end of the hallway in our building did.
I think when we remove those silos, it helps us, again, to bundle services that are unique to each family. It helps us to not treat everybody as if they're the same. You know, we are all different, all our families are different, and we need to do that. So we need to keep concentrating on breaking those silos down, and we need to make sure that the staff understands that, you know, this is a team effort. It always has been. I mean, you know, social services can't be done by one person, one agency. We have to all work together so that we can get the outcomes that we're looking for.
You can be a family that comes in through any portal, through any program here at Community Action, and we do one intake, and we can determine your eligibility for several programs, many programs at that point in time. And that creates a more efficient use of time for those we serve, not to have to do multiple intakes and give the same name, rank, and serial number type information. It also keeps one file on one family, and so we don't have multiple open files open on the same family.
The Crisis to Thrive is kind of like the thermometer. It allows us to find out very quickly which areas the families feel that they're successful in and which areas that they might be struggling and need some help. That leads us into being able to develop a pathway plan that is exactly tailored and suited for whatever need that that family might have.
Families come to Garrett County Community Action for an array of services, and the family assessment that we use is the Crisis to Thrive. This would be the first step to creating the pathway plan as we see where the family falls in multiple areas. The pathway plan is then created through coaching. All coordinators here use a coaching model, and the pathway plan includes headline goals that are standard throughout the agency, along with their exact word description of what they want to accomplish. This is related back to their Crisis to Thrive and also includes action steps and resources to reach these goals. What makes our pathway plan process stand out from others is that it isn't a one-size-fits-all plan. Every family that comes into Community Action has a plan tailored to their needs. We wouldn't be able to implement this plan without all of our partners.
Well, effective two-generation anti-poverty work really requires the participation and effort of an entire community. And in Garrett County, we've really been blessed with the participation, the active participation of the Health Department, Community College, the Department of Social Services, School District, and others. And that's made all the difference. They each have an important role to play, and the work that we're doing today around two-generation efforts just could not take place without their support and active involvement.
I think collaboration is the key component in this work that we're doing, and I think that we're all very committed to what we bring to the table, but it's really when we pull our resources and everybody's working together that we're seeing the best success. We each have our own individual outcomes that we're trying to achieve, but at the center of it is the client and the desire to see them be successful and how we can pull our resources to make that happen as quickly as we can. The Workforce Development Division of Garrett College is really focused on identifying opportunities within the county, within the region that employers are seeking. And in response to that, we've really tried to identify areas that we can provide training that leads to some sort of nationally recognized credential. Most of the training programs end with a certification exam, and we feel that that helps them be more marketable as they're out doing the job search process.
So Empower, we've been using a product called Empower to manage our data. and our intake process. And Empower really evolved over the course of 3 or 4 years of constantly tweaking an older software platform. Empower is a cloud-based data management system, and the beauty of the system is that it captures all the data and manages it in one centralized database. In the past, we've had as many as 32 different databases to manage because of all the different grants and programs and services that we provide and administer. So Empower is able to talk to all of the different requirements and speak to all of the different criteria and reporting requirements that different funders have. This centralized management system is more efficient for the people we serve, and it's also more efficient for the organization in tracking our outcomes.
So most of crisis is somebody doesn't have a place to sleep that night, or they don't have food that night, or they have their electricity shut off or their water shut off. So we do a basic intake and go from there. We kind of we do our Crisis to Thrive, see what steps that they're doing well in and what ones they need improved in, and then we figure out what funding and what resources in the community can help them to get out of their crisis and stabilize them.
You know, poverty does have a face of its own in a rural community. In an urban community, you know, we see it more. It's more evident. It's out there for us to see. In a rural community, it's a little more hidden because we don't have homeless people living on the streets generally, and a lot of people know other people. So there's a lot of relationships between the people who live in poverty that help each other out. But I think the thing that you see the most is isolation. A lot of families live far from a town, and so they're isolated, a lack of jobs, and so their choices are limited. And when you limit choices, it limits the opportunities people have to get out of poverty. It also, I think, reflects on what Lyndon Johnson was trying to do, which was not just focus on the poverty of money, but the poverty of spirit. And when you are isolated and when you have limited opportunities, it's very hard to keep your spirits up. And so I think that you see a lot of anger, some bitterness, and so those, I think, reflect far more when you look at a rural area.
Nine years ago, I started with Community Action, and I technically started with the housing program when I found out I was pregnant with my first child, and that also took me into the early Head Start home base. And from there, I have learned that struggling every day, you can come out of to stand on your own 2 feet. And standing on my own 2 feet now, I look back and I think that like 9 years ago, if I didn't take the steps of coming to Community Action in the first place, that I wouldn't be where I'm at now. And in those 9 years, we have went from the housing to moving on our own and being able to have our own home to provide for our children in a way that we didn't think we could. And we also got energy assistance because we were low income. And we then went into the center base of Head Start, where our kids have accelerated in everything. And was able to get with a budgeting counselor, and we were able to get our credit back on track, and we own everything we have now. And it also allowed me to become part of the parent groups, the policy council, to be a substitute, which I originally wanted to be a teacher. And getting pregnant at a young age kind of gave me that obstacle, but Head Start gave me the chance to put my feet in the door that I didn't think I was going to be able to do.